Imagine like a highly advanced, intelligent mesh fabric. It's biologically engineered to stretch to just an unbelievable degree,
Hmm.
absorb immense physical trauma, and then ideally seamlessly snap back into its original shape.
Right, which is an engineering marvel on its own.
Exactly. But now imagine that over a couple of decades, the underlying threads of this fabric slowly, quietly begin to swap themselves out.
Oh, wow. Okay.
Yeah, so the flexible elastic threads are gradually replaced by rigid wire. Then you subject this newly stiffened mesh to its ultimate stretching event. And at the exact same moment, you plunge it into a chemical bath that completely shuts down its self-repair system.
I mean, it sounds like you're setting up a scenario for total structural failure.
Right. That is exactly what you might expect from a purely mechanical perspective. But we are looking at something far more resilient yet incredibly complex.
Yeah,
We're talking about the marvel of childbirth and specifically what happens when it collides with the realities of cellular aging. So welcome to this deep dive.
it's a great topic.
Today, we are chasing down a really fascinating biological paradox hidden in the clinical data. We want to know, how does an advanced age at first pregnancy fundamentally alter the baseline cellular recovery, and specifically the moisture output of the postpartum vaginal tissue?
And this is just such a critical conversation for you, the listener, to hear right now, because globally, the demographics of childbirth are shifting,
Oh,
right?
absolutely.
More and more women are having their first child later in life, yet so much of the standard postpartum advice completely ignores the cellular reality of a body that has, experienced 3 or 4 decades of life before that event even happens.
Yeah, it's like a one-size-fits-all approach.
Exactly. We treat recovery as this universal timeline, and the biology tells us it absolutely is not.
So to figure out why that timeline diverges, we pulled together a massive stack of sources today. We've got histomorphometric analyses of vaginal tissue, transperineal ultrasound studies, clinical guidelines from the NHS and the Women's Health Clinic,
Lots of dense data.
tons of it, and some truly cutting-edge molecular research from the journal Frontiers.
And the molecular story hidden in those clinical documents is just incredible. We're going to move past that general advice of like, oh, just give it time and look closely at the signaling proteins.
Right, getting into the weeds.
Yeah, the changing collagen ratios and the actual microscopic junctions between cells that dictate how the body heals.
Okay, let's unpack this. But before we can even look at how age alters the healing process, we really need to establish a baseline.
Good idea.
We have to understand what happens to anybody at any age immediately after childbirth. Because reading through these clinical guidelines, the hormonal shift that happens the moment the placenta is delivered is, honestly, it seems incredibly violent.
That is a biologically accurate way to describe the transition, actually. During pregnancy, a woman's body is just flooded with soaring levels of estrogen and progesterone.
Right.
The placenta itself acts as this massive temporary endocrine gland, basically churning out these hormones to sustain the pregnancy and prepare the tissue for delivery.
It's a whole factory.
Exactly. But the moment that placenta is delivered, the factory shuts down. Just boom. Within a matter of 24 to 48 hours, estrogen and progesterone plummet right back to pre-pregnancy levels,
Okay.
or sometimes even lower.
It's wild because I always thought of postpartum recovery as just, resting muscles that were overworked. I didn't realize there was this massive chemical withdrawal happening simultaneously.
Huge.
Yeah, the sources from StatProls point out that this sudden drop in estrogen triggers a massive cascade of events. Like, for instance, in the uterus, it leads to a huge reduction in the size of myometrial cells. It also ramps up the activity of collagenase.
Right, and collagenase is an enzyme that literally breaks down collagen.
Wow.
Yeah, the body needs to rapidly dismantle the excess uterine tissue built up during pregnancy. It has to stop the bleeding and shrink the uterus back to its normal size. So it's a highly destructive but totally necessary physiological process.
But the effects in the vagina are where our sources really focus today. Under normal, healthy, estrogen-rich conditions, the superficial epithelial cells lining the vagina are constantly turning over and shedding. And as they shed, they release large amounts of a substance called glycogen.
Right, and glycogen is essentially stored cellular energy. It's a complex sugar. In the vaginal microbiome, it serves a very specific purpose.
It's food, basically.
Exactly. It's the primary food source for lactobacillus. Those are the healthy commensal bacteria that dominate a healthy vaginal environment. So the lactobacillus consume the glycogen and produce lactic acid as a byproduct.
Okay.
And that lactic acid is what keeps the vaginal pH at a highly acidic Protective level, usually somewhere between 3.8 and 4.5.
Which protects against infections, but then, that massive estrogen crash happens after delivery.
And the entire environment just grinds to a halt.
Wow.
The sudden lack of estrogen stops the proliferation and shedding of those superficial epithelial cells. The mucosal layer thins out so rapidly that the superficial cells drop to making up less than 10% of the tissue.
So the food supply gets cut off.
Completely. If the cells aren't shedding, they aren't releasing glycogen. And without glycogen, the lactobacillus literally starve.
It really paints a picture of draining a thriving aquatic ecosystem overnight. Like, you wake up and the water, which in this case is the estrogen, has simply vanished.
That's a great analogy.
Yeah, and the primary food source, the glycogen, just disappears with it. Your healthy bacteria just cannot survive the new, barren environment. The result is that the vaginal pH shoots up above 5, becoming far more alkaline.
And that alkaline environment disrupts the mucosal immunity completely. The tissue becomes incredibly vulnerable to inflammation and opportunistic pathogenic bacteria.
Which explains a lot of postpartum discomfort.
Definitely. Clinically, it typically takes 6 to 10 weeks for the vaginal epithelium to claw its way back from this atrophic state and restore its normal thickness and pH.
Right.
And if a mother is breastfeeding, the hormone prolactin, which stimulates milk production, it actively suppresses estrogen even further.
Oh, wow.
Yeah, so that can drastically delay the recovery timeline well beyond that 10-week mark.
Okay, so that brings up the big question I had while reading through all this. If this massive cellular shock, the sudden ecosystem drain, happens to every single person who gives birth, why are we looking at advanced maternal age?
Good question.
Like, why is a 38-year-old body reacting differently to that exact same drop in estrogen than a 22-year-old body?
Well, the answer requires us to look at the scaffolding of the tissue itself prior to the pregnancy.
Yeah.
We really have to examine the baseline of the aging vagina.
Okay, let's get into it.
One of the most revealing sources in our stack is a histomorphometric analysis. So it's a highly detailed microscopic study of tissue structure looking at the vaginal wall in women across different age decades.
And the findings in that analysis are stark. They show that as a woman crosses the age of 35, the structural scaffolding of her pelvic floor has fundamentally changed on a microscopic level.
Yes.
Just visually, the color of the vaginal mucosa gradually shifts from a healthy pink to a pale or even dark red. The rugae, which are those accordion-like folds that allow the vagina to stretch and expand, those decrease in density, the epithelium itself physically thins out.
And the most profound transformation is happening in the extracellular matrix, the connective tissue that supports the whole structure.
Right.
The researchers used a technique called Sirius red polarized light staining. It essentially allows them to clearly visualize and differentiate between different types of collagen under a microscope.
Okay.
And they discovered that as a woman ages, the ratio of type 1 to type 3 collagen significantly increases in a highly age-dependent manner.
Now, I usually only hear about collagen in the context of, like, face creams or joint supplements.
Oh, right.
What is the actual functional difference between type I and type 3 for the pelvic floor? Because that changing ratio seems to be the core of the whole issue.
It is. So think of type 3 collagen as the youthful, flexible, compliant collagen. It provides young tissue with its elasticity and its ability to stretch without breaking.
Okay, so type 3 is stretchy.
Exactly. Type I collagen, on the other hand, is much stronger, but it is rigid, it's stiff. So an increasing ratio of type I to type 3 means the foundational tissue is literally becoming stiffer and less elastic over time.
Wow.
On top of that, the overall collagen content in the lamina propria, which is the layer just beneath the surface epithelium, is greatly reduced. And the elastin fibers actually begin to fragment and break down.
Here's where it gets really interesting, though. The sources show it isn't just the connective tissue getting rigid, it is the actual individual cells themselves.
Yeah, this part blows my mind.
There is a fascinating detail about how aging causes a decrease in a specific protein called G-actin.
Right, so G-actin is a vital building block of a cell's cytoskeleton. You can think of the cytoskeleton as the internal scaffolding that gives a cell its shape and allows it to move or flex.
Okay.
When G-actin levels decrease due to cellular aging, it causes the remaining structural proteins to shift toward a state of polymerization. Basically, the flexible internal scaffolding of the cell locks up. It forms a highly rigid cytoskeleton.
Wait, so even before the mechanical stress of a baby arriving, the structural scaffolding of the vagina is already fundamentally stiffer.
Yes.
It has fewer expansion folds, and the individual cells are locked into a rigid cytoskeleton. How does a more rigid structure handle the ultimate stretching event of childbirth?
Well, that is the collision we mentioned at the very beginning. It's the intersection of advanced maternal age, typically defined in these studies as 35 and older, at the time of delivery meeting postpartum mechanical trauma.
Right.
When you take that older, stiffer, less elastic baseline and subject it to the extreme stretch of a first vaginal delivery, the tissue processes that trauma very differently than younger tissue would.
And we have an incredible transperineal ultrasound study from the journal SRP that proves this isn't just a theory, right?
Yes, absolutely.
They looked at women having their first vaginal delivery and compared a group under 35 with a group of advanced maternal age. And they specifically measured a structure called the levator hiatus.
So for you listening, the levator hiatus is essentially the gap or the opening in the levator muscle complex of the pelvic floor. It is the literal anatomical space the baby actually passes through during delivery.
Right, and the ultrasound data from this study is just undeniable. They measured these women at 3 months postpartum and then again at 6 months postpartum.
Uh-huh.
And the anteroposterior diameter of that levator hiatus was significantly greater in the older mothers compared to the younger mothers.
And we really need to emphasize a crucial point from that study. This widening was present even in the women who were completely continent.
Meaning they didn't have symptoms.
Exactly. They didn't have any physical symptoms like stress urinary incontinence. But the anatomical gap remained physically wider in the older mothers a full 6 months out.
Wow.
It's tangible, structural proof of a delay in tissue recovery. The muscle simply did not snap back the way the younger muscle did.
If you are a listener planning a pregnancy later in life, or, if you've recently navigated one, this data is incredibly validating.
So validating.
It is not in your head if your recovery feels prolonged. Your biology is literally orchestrating a different healing timeline based on the age of your tissues. And the source from Frontiers goes incredibly deep into how that orchestration works at the cellular level.
It all comes down to the inflammatory response.
Okay.
Any vaginal delivery triggers acute inflammation, which is mediated by cytokines. And cytokines are basically signaling proteins that cells use to communicate.
Right.
In the early stages of wound healing, pro-inflammatory cytokines recruit immune cells to rush in and clean up the damaged tissue. This is a normal, healthy, and entirely necessary first step.
But the older tissues, hitting that intense estrogen crash we talked about earlier, they seem to get stuck in this aggressive phase.
Yes, exactly. The inflammatory milieu becomes prolonged. The tissue struggles to make the critical biological transition from the destructive inflammatory phase to the reparative phase.
Huh.
In a normal healing timeline, those pro-inflammatory signaling proteins should quiet down after a few days. They should be replaced by tissue repair mediators, which are different signaling proteins that promote healthy collagen synthesis and the formation of new blood vessels.
So the older hypoestrogenic tissue gets caught in an inflammatory loop. And the animal models in our sources back this up dramatically.
Oh, yeah.
There is a study in Digital Commons using mouse models where researchers surgically removed the ovaries to simulate that severe sudden loss of estrogen. They wanted to see how the extracellular matrix reacts.
And one of the most striking findings from that murine model involved the behavior of a specific matricellular protein called periostin. In the estrogen-deprived state, the production of periostin was upregulated by almost 65 times compared to the control group.
Wait, really? 65 times the normal amount. What does an overload of periostin actually do to the tissue?
Well, periostin is heavily involved in driving fibrogenic responses. In simpler terms, it drives scarring.
Oh, wow.
Yeah. When periostin goes into overdrive, it signals the fibroblasts, the cells responsible for building connective tissue, to lay down stiff, non-functional scar tissue.
Instead of the elastic stuff.
Exactly. It overrides the signals to regenerate healthy elastic muscle and mucosa. So instead of bouncing back, the older pelvic floor muscles heal with more rigid collagen. They generate less force, and they stay physically stretched out longer, which perfectly explains the lingering gap seen in that ultrasound study.
That perfectly explains the physical structural recovery delay. But reading through the clinical guidelines, there is a second major component to this deep dive today. It's arguably the most intensely frustrating symptom for these mothers, the severe lack of moisture output. Why is postpartum vaginal dryness so specifically compromised and so persistent in older mothers?
Well, we often think of dryness as a glandular issue, right?
Right.
Like a lack of surface liquid or sweat.
Yeah, that's what I assumed.
But in the vaginal epithelium, moisture is actually a product of cellular permeability. Vaginal moisture is essentially blood plasma. It originates in the rich blood supply beneath the tissue, in the capillary beds, and then it filters up through the layers of cells into the vaginal lumen.
Wait, so it isn't a gland secreting fluid, it is fluid seeping between the cells.
Exactly. And how easily that plasma filters through is controlled by microscopic gateways called tight junctions and the lateral intercellular space.
Okay.
Think of tight junctions as the seals between adjacent cells and the lateral intercellular space as the physical gaps or channels between them. When you combine the natural aging process with a severe low estrogen state, the physical resistance in both of those pathways
Okay,
skyrockets.
because of the cytoskeleton.
Yes. Remember that rigid cytoskeleton we discussed? The one caused by the decrease in G-actin.
Right, the stiff internal scaffolding of the cell.
Yeah, that rigid cellular structure physically blocks the plasma from moving through the spaces between the cells. The gates are essentially locked shut. The cells lose their flexibility to allow fluid to pass around them.
So what does this all mean? It paints such a frustrating picture. The moisture might be right there in the blood vessels underneath the tissue, but it's physically trapped behind a wall of stiffened cell junctions. It just cannot reach the surface.
And, to compound the problem, the blood supply itself is compromised. Estrogen normally promotes healthy blood flow by acting on an enzyme called eno-epithelial nitric oxide synthase.
Okay.
ENOS produces nitric oxide, which is a powerful vasodilator. It relaxes and opens up the blood vessels, bringing in that vital plasma to fuel the moisture.
So ENO is the dilator. What happens to it when the estrogen crashes?
Well, without estrogen to guide it, the system gets hijacked. The research shows that in a hypoestrogenic state, a protein called caveolin-1 binds directly to the ENOS enzyme.
And what does that do?
Caveolin-1 acts like a biochemical parking brake. When it binds to ENOS, it completely shuts down the enzyme's ability to produce nitric oxide, which stops the blood vessels from dilating.
Wow. So the fluid can't get there because the blood vessels are constricted by caveolin-1, and even if some plasma did make it, the tight junctions are locked shut by the rigid cytoskeleton.
Exactly.
The clinical result of all these compounding factors is severe postpartum vaginal dryness. The tissue becomes atrophic, pale, and friable, which means it tears very easily.
Yes.
And this leads to dyspareunia or painful sex, which can persist much longer in mothers of advanced maternal age until their estrogen levels finally normalize and that cellular permeability is restored.
It's an incredible chain reaction.
Yeah.
The macroscopic symptoms that patients report to their doctors, the severe dryness, the prolonged physical recovery, the pain, they are completely dictated by these microscopic battles over G-actin flexibility and caveolin-1 inhibitors.
It fundamentally reframes how we should view postpartum care. I mean, it isn't just about waiting for a wound to heal over a standard 6-week period.
Not at all.
It's about understanding that an older cellular environment processes trauma and hormonal withdrawal through an entirely different set of biological rules than a younger one.
We really have to move past a one-size-fits-all approach to recovery. The tissue architecture is different, the inflammatory signaling is different, and the fluid transport mechanisms are locked down.
So to pull all these threads together for our deep dive today, when a woman has her first pregnancy at an advanced maternal age, her vaginal epithelium enters that physical event with a stiffer type 1 to type 3 collagen ratio and a naturally reduced elasticity.
Right.
Then she is hit with the universal postpartum estrogen crash. This older, stiffer tissue experiences a prolonged inflammatory loop, heavily upregulated scarring proteins like periostin, and delayed structural recovery, which we can literally measure on levator hiatus ultrasounds months later.
And simultaneously, that low estrogen environment in an older cell locks down the tight junctions and throws the brakes on the blood vessels, physically trapping moisture beneath the surface and causing profound, lingering dryness.
It is a lot of complex biology to process, but there is a really fascinating concept hidden in the MDPI source on vaginal aging that points to where the future of the science might be heading.
Oh, this is the best part.
Yeah. We know that aging alters DNA methylation in the vaginal mucosa, basically, the mechanism that turns certain genes on and off. And we know that specific postpartum cytokine profiles dictate whether tissue heals elastically or scars over.
Which raises an incredibly provocative question based on this data. What if, in the near future, we didn't just accept this delayed healing timeline as an inevitability of age?
Right.
What if we could use targeted epigenetic therapies or highly specific, localized tissue repair probiotics that modulate the inflammatory signals to temporarily reprogram the DNA methylation of the vaginal microbiome?
Imagine the implications of that. Could we eventually cue older vaginal tissue right after delivery to bypass that inflammatory loop entirely? To heal with the exact cellular elasticity, the exact GIAC flexibility, and the exact moisture output of a 20-year-old?
I mean, the molecular groundwork we've uncovered in these sources today suggests that it isn't science fiction. The pathways are there. It's just a matter of learning how to unlock them at the right time.
We encourage you to keep questioning the standard narratives and keep exploring the amazing machinery of your own biology. It turns out your body is much like that specialized mesh fabric we talked about at the very beginning. Yes, the threads might stiffen with age, and the chemical baths might test its limits, but once you understand exactly how the engineering works at a molecular level, you realize just how remarkably designed it is to eventually rebuild itself. Thank you for joining us on this deep dive.